and we're very honored and pleased to be hosting Dr. Christine Montross, who is the author of Waiting for an Echo, The Madness of American Incarceration, and a book that I know a number of you have already read. Dr. Montross is Associate Professor of Psychiatry and Human Behavior at the Warren Albert Medical School of Brown University, and a practicing inpatient psychiatrist, and also does evaluations of people awaiting trial. And she's an award-winning poet and author of two other books called Body of Work and Falling into the Fire. Interviewing Dr. Montross today are two supporters of Interfaith Action for Human Rights. Gay Gardner was one of the founders of Interfaith Action, and was the secretary of our board for 6 years, and is a special advisor to Virginia regarding Virginia people incarcerated in Virginia, and also advocacy and legislation in Virginia. Joining Gay in interviewing Dr. Montross is Troy Berner. Troy joined the Changing Perception team in June 2020 as a mentor or peer navigator. In this world, he works with individuals recently resentenced and released under the Incarceration Reduction Amendment Act of 2016, or as it's referred to in DC, IRA, its initials, lending, support, and connecting local resources and programs. He also works with individuals housed in the DC jail waiting resentencing for IRA hearings. Troy is a native Washingtonian. He was arrested and charged with murder, assault, and with intent to kill and weapon violations. He was later found guilty of all these charges and sentenced to 30 years to life in prison. He served 24 years and 8 months and was released on November 5th, 2018. On March 26th of this year, Troy's conviction was reversed and vacated, and the indictment was dismissed on August 27th, 2020. Troy is an advocate for those in the system, a mentor, and aspiring motivational speaker. So I'm going to hand it over to our interviewers and welcome everyone.
Thank you for having me.
Should I go first, Chuck?
Sure.
Sure.
This is a real treat to be able to discuss your book with you, Dr. Montross. I love the book, and I'm really pleased that you could join us today. One thing I was curious about is how did you choose the title of your book? I know it's a quote from James Baldwin, if I'm not mistaken, but what does waiting for an echo mean to you in the context of incarceration?
Yeah, thank you. So happy to be here. Thank you for having me. And I'm delighted to know about this organization and really pleased to connect with you all today. So it's actually a Richard Wright quote, two equally great thinkers, James Baldwin and Richard Wright. So both equally inspiring writers and thinkers. So interesting that you ask about them in particular, because the quote was one of the first kind of foundational elements in place for me as I began writing this book. So the book emerged from me out of my work as an inpatient psychiatrist working with severely mentally ill men and women. And I work on what's called the intensive treatment unit of a freestanding psychiatric hospital. So these are people, it's like the psychiatric version of the ICU, people who are very mentally ill, actively hearing voices or seeing visions, actively trying to hurt themselves or other people. And what I found in the course of my work there over the last several years is how frequently my patients were coming in contact with police, and some of them serving time in jails and prisons. So that was really the impetus for me to begin researching jails and prisons, what happened to my patients when they ended up in these places. And what I found when I entered into the jails and prisons was not just that my patients became worse in these environments, But even people who were mentally well going in became psychologically damaged by these institutions and our practices in these institutions. So that was really the starting point of the book. But I read that Richard Wright quote early on in my research, and it was sort of a galvanizing mantra for me as I was going through this idea that people held in these facilities in our country are so often voiceless. And so this idea of sharing their stories, sharing the experiences, sharing the conditions they live within, in the hopes that they would wait for an echo, that we would amplify that we would respond to them. And then there was a moment in researching the book that I linked the quote to very clearly in the story of the book, which was a detention facility, a high security. I'm not. Do you hear me, Gay? Because you all froze for just a moment. Are you hearing me still?
You froze a little bit.
Okay, all right. I'll just reverse and say I was visiting a high security prison for 14 to 20-year-old boys. And as I walked by, I saw a boy standing on his toilet talking to the ceiling. I assumed that he was mentally ill until I saw another boy doing the exact same thing. And I said to the correctional officer, "Why are they standing on their toilets?" And he said, "It's a big problem. They found out they can talk to each other that way. It's loud in here. They're not supposed to shout out through the doors, but they found that if they talk to the vents, they can carry on whole conversations that way." That was a really crushing moment for me as the parent of a teenager, but also just as a human being, to see these children, these boys who were 14 to 20 years old, reaching out for some kind of a connection. And so that idea that they were calling into the void of these vents to try to make some kind of human connection with one another when we've put them in this extremely restrictive environment really immediately connected for me back to that Richard Wright quote and the idea of so profoundly waiting for an echo.
Mm-hmm. One of the basic arguments you make in the book is that if the goals of incarceration are public safety and justice, our current practices are undermining those goals. Can you give some examples of how that happens, how our practices are defeating the goals of public safety and justice?
Absolutely. So one of the things I learned early on in my research that surprised me was that 95% of the people we incarcerate are released. That means that 95% of people come back into our communities. And when we say that we want safety and justice, but then we treat people incarcerated. Then when they return back into our communities, they've been that disserves us. To treat people poorly does not serve us well, is not in our best interests of safety, to have people return to our communities after we've treated them so badly and damaged them in many ways. But also, it doesn't hold up our ideals of justice. It's not just. The justice in the justice system is that the punishment is we take away your liberty, that we do not allow you to live at home and make the choices that you're used to taking. Additional punitive aspect, that the time while your liberty is taken away is also miserable. And yet we insist upon that. We really, as a society, insist upon suffering and vengeance being a part of the punishment. And what I found over the course of my writing is that those two aims are antithetical to one another. You can't simultaneously want safety and justice and want vengeance and suffering. Because if we insist upon vengeance and suffering, we lose the ability to focus on safety and justice. Because the practices that reinforce suffering and vengeance are not good for the safety of our communities. They're not good for the safety of our prisons, and they're not good for our system of justice. But if we want these outcomes over here, if we want safety and justice, if we want people to return into our communities as functioning members of society who work jobs and pay taxes and are able to maintain connections with their family members and their communities, then we have to stop prioritizing practices that that make them suffer while they're in prison. We have to embrace the idea that prison should be rehabilitative, should have education, should have job training, should have mental health and substance abuse treatment, instead of being a place that by definition is meant to make people suffer during their time there.
I want to bring Troy into the conversation. Troy, what's on your mind in this regard?
Well, first of all, Dr. Montross, I read the book. I was very impressed. It was very familiar to me, coming from your aspect, and me experiencing being in that setting, for the last almost 25 years. Was very informative for someone that doesn't know. But for me, a lot of things that at home you just spoke on, the standing on the toilet, talking through the vent, the ways to communicate, and there also are, such things as it's a very traumatic situation, so I was telling Gay and Rabbi Chuck that I kind of akin incarceration to the TV program The Walking Dead, because especially and it really doesn't make a difference how much time you're sentenced to, because more often than not, same custody, different custodies are around one another. So, you subject to see all types of things and plats from, this space to that space. And, and it's really a fight, to live, to live beyond that circumstance. So I wanted to ask you, could you please talk about the misalignment between what jails and prisons expect of prisoners and the symptoms of mental illness?
Thank you, Mr. Berner. So nice to meet you, and so nice to hear from you that you felt that the book fairly represented what you and so many others in our country go through. That means a great deal to me. So thank you for that high compliment. And that misalignment is such a critical interest of mine because of how many people in jails and prisons do struggle with mental illness. 20% of people in jails and 15% of people in prisons have serious mental illnesses. So these are schizophrenia, schizoaffective disorder, bipolar disorder, major depression. That's more than 350,000 people in our prisons in America that have these kinds of illnesses. And that's not even counting the illnesses that we have decided to treat as crimes instead of illnesses, which are the substance abuse illnesses that so many people struggle with. So what I write about in that book, that misalignment that you reference, is this idea that in jails and prisons, and we see the same thing with policing, that the expectation is compliance, right? When police or when correctional officers give a command, give an order, they expect people to comply. If you do not comply, there are consequences to that. So that those consequences include force, they include additional degrees of punishment. When someone is mentally ill, when they are hearing voices or seeing visions, when they are extremely paranoid, when they are manic and so believe that no harm can come to them or that they might have special powers, or when they're so depressed that they might not even be able to initiate the movement necessary to respond, they cannot comply in the ways that correctional officers or police command them to do. And so you have this misalignment, which is a system that is set up for obedience and people who cannot obey. And what that means is that mentally ill people are substantially more likely to accrue additional punishments all the time. And that can result in, I write about an incident where a paranoid man was taken into custody. At the time of his arrest, he hid behind a dumpster and was forced out from behind the dumpster by police. He got into jail, wouldn't take medication in jail because he was so paranoid, and then was forced out by correctional officers of his cell during what they call a cell extraction, which was a new term for me, where correctional officers descended and pulled him out, and he fought back. And when he hit a correctional officer, he had been arrested on misdemeanor charges. Less than a year in jail would have been his maximum had he been found guilty. And when he hit the correctional officer, that's a felony assault charge, assault on a correctional officer, that can come with 15 years in prison. So suddenly someone acting out of their symptomatology responds in that moment of misalignment, and the whole trajectory of their lives changed. And one of the things that I learned a lot about was that how quickly that can happen with people within the system in administrative segregation or solitary confinement also. So we have this presumption, I think, those of us on the outside, that people go to seg because they're extremely violent or they commit these horrible infractions. And what I learned, and I'm sure you can speak to as well, is that it's much more often this accumulation of sometimes very small nonviolent infractions, but can multiply, so people spend long periods of time in solitary confinement, which of course can be devastating for people, any people, but people with mental illness in particular.
Right. And I think what you're saying is consistent. And I guess I was going to wait a little later to ask this question, but I wanted to ask, in relation to mental illness. We have it's universally accepted that children don't grow, their brain doesn't grow to its full capacity until 26, 27 years old. And that's just not a theory. That's, has been scientifically proven. And one of the problems I have, with the system in this country is, how we treat our kids. And obviously, when a crime is committed, it's going to be necessary for some type of accountability being held, but for, juveniles being put in the juvenile system, and it's like they're already behind. And I guess what I'm trying to say is that juvenile offenders are, in a lot of ways, mentally deficient, as with a mental illness. There are certain things that they're accustomed to seeing. We products of we learn by habit, things that we see, and as kids, you formulate your mind to assume that certain things are all right. What do you think about how I express that? Because I think we get past the fact we go with certain things that's happening, obviously, in a lot of cities, urban cities around the country. A lot of the violence that's going on is with kids, but a lot of it, is you can't miss the fact that they are kids and they're mentally deficient, and it's necessary to keep that in mind in how you deal with them, and you automatically put them into the adult system, or you put them in the adult system when they're 18, but you're still talking about them being in a situation where their growth has been stunted, and then it drags along, and they force to not necessarily grow up in the most literal sense, but they got to grow up in the most physical sense. And it's obvious that the two, they can't go together. Is impossible. So what do you think that could be done, to we can follow this science, that's already been proven, and stop with I guess in a lot of ways it's fear mongering, a lot of things happen, you don't understand a lot of people things until it affects them directly. What do you think we can do about changing the approach of how we deal with kids who, juveniles, they actually mentally and socially deficient.
What a wonderful question. So there are like 6 different things in that question that I would like to respond to. So I'll do my best to question, thinking about kids from many different perspectives. So one thing that you said that really struck with me that's absolutely true is that neurodevelopmentally, we know kids are not fully developed in the front part of their brain, the frontal lobe that controls what we call executive function. So this is decision making, controlling impulsivity. That does not develop into the 20s, later in the 20s, even for boys. So you're exactly right that it's what one child psychiatrist I heard speak called as having a foot on the gas and leaky brake lines, that kids in that age of 15 to 23, they're impulsive, they're seeking excitement, but they don't have the brakes that they need yet. And so you're absolutely right that neurodevelopmentally, they're vulnerable in that way. And so decision making is off for kids, and that's a consideration that I think is beginning to come into the question of juvenile sentencing, as it should. But it's also then so critically important that we say, the other piece that you say, like growing up, sort of being forced to grow up in one way and not being allowed to grow up in another. When you think about what children need to develop normally, and then you think about what happens when we incarcerate children and how they're robbed of some of those things. And I think the foremost example of this is when I visited that juvenile detention facility that I wrote about, that I described the boys on their toilets. That facility, which, by the way, is in blue state America, some of them with some of the more liberal policies, that facility allows boys to be kept in solitary confinement for up to a year. So these are 14 to 20-year-old children. Their brains are still developing. And now we have to think about, how does a brain develop a normal developing brain needs? So there are you talk about the science, Mr. Berner, and there are studies about children raised in orphanages or children raised in institutions that don't have the kind of regular interaction and stimulation, and how the physical nature of their brains changes, that we can see. And when you look at their brains, that their brains are underdeveloped in certain ways and overdeveloped in other ways, that they have to grow up in certain ways that other kids don't have to, and that they're stunted, their growth is stunted in certain ways as well. So you're right that the science of this is really critically important to pay attention to. The psychology of it is important to pay attention to, because when you're talking about the communities that many of these kids come from, many of these children have themselves experienced trauma. They've witnessed violence in their communities, in their streets. They've witnessed friends be injured, family members be injured. They may have even committed acts of violence themselves, which we know can be very traumatic for a child to do, even if the child is the one responsible for the act of violence. So these children themselves have experienced trauma, which in turn affects their brains. So we have the neurological aspect, we have the psychological aspect, and then I think we cannot talk about this question without talking about the way that racial bias affects our treatment of juveniles. So Black kids are more than twice as likely to be arrested in the first place than white kids are for the same crimes. They're less likely to have their cases diverted away from the justice system. They're less likely to get probation instead of jail time. White kids are more likely to get probation. Black kids are more likely to be sent to jail. And up until 2010, juveniles in our country could be sentenced to life in prison without the possibility of parole. A Supreme Court case in 2010 finally said it was not constitutional to do that, to lock a kid up for the rest of his life without the possibility of release. But up until 2010, we could. The state of Florida led the country in sentencing juveniles to prison without the possibility of parole. 84% of the kids they gave that sentence to were Black. And the population, the African-American population in Florida, is less than 16%. So you see this overrepresentation and harsh sentencing over and over again to kids of color as opposed to white kids. And I know I've talked a lot, but there's so much in this question that I want to answer. I'll end with one other story, and that is there was a really beautiful, haunting study done out of Stanford looking at that Supreme Court case where they took They took the real life Supreme Court case and they took 700 white subjects, and they chose white people because we're overrepresented in the judiciary and jury pools in legal fields. They divided those 700 white people in half, and they gave them identical descriptions of one of the boys involved in the case. Was a 14-year-old boy with 17 prior juvenile convictions who was convicted of a brutal crime against an elderly woman. And they changed one word. So 350 of the people saw the subject described as a black male with 17 prior juvenile convictions, and 350 people saw the child described as a white male with 17 prior juvenile convictions. That's the only word they changed in the whole study. And the subjects who read about the black child expressed significantly more support for life sentences without the possibility of parole for juveniles. And they also were far more apt to say that juveniles should be held responsible in the same way that adults are. People who read about the white child said some of the things that you said, that, oh, juveniles maybe shouldn't be held to the same standard of guilt. So yes, we should look at children differently, and we need to really examine how, even within the system, we are treating some children differently and less fairly than we are treating other children.
Well, that's really stunning. I wonder if you could go back to the solitary confinement issue for a minute. Can you say a bit more about some of the long-term effects of prolonged isolation on people who experience it? And what do you think are some better ways of dealing with prisoners who act out in a way that poses an immediate threat to the security of the prison or to people who live and work in it?
Yeah. So as I said, one of the things that was most surprising to me was realizing how many people serve substantial periods of time in solitary for nonviolent offenses. So the first thing I would say is that should just stop. that system, because many people don't understand that solitary confinement is a punishment that is adjudicated entirely within the prison system. No judge sentences someone to solitary confinement. There's no trial process that brings that about. That's a punishment that's entirely handed out by the prisons and the jails. So there's no judicial oversight to how that's administered. And so first and foremost, it seems to me to be extremely inhumane to have that be a punishment for people who are accumulating nonviolent infractions. The other thing that I think it's important to say is that we look at, I think people say, well, you need solitary confinement for people who do very violent things. And what we see in study after study after study is that the use of solitary confinement does not, in fact, reduce violence. It doesn't reduce violence from between inmates. It does not reduce violence from inmates onto correctional officers. So also our premise, our rationale behind using it does not hold water. So what you see is when facilities reduce or stop using solitary confinement, their rates of violence actually go down. And I think that then, to talk about that a little bit, it helps to look at the first part of your question, which is, what does solitary confinement do to people who are held within it? And we know this not just from solitary confinement in prisons, but there have been some really fascinating studies that have been done in a range of different settings on humans in isolated circumstances. So people who are shipwrecked and on islands, people who work in Antarctica at these extremely isolated scientific communities down there, people who have to do space travel or have long periods of time flying planes without any kind of sensory input above the clouds or in darkness. And we see these typical, predictable patterns of brain change in people who are isolated from external stimulation and human interaction. And one of the things that we see is that people, no matter which circumstance they're in, can begin to have these violent, aggressive fantasies. So if you look at the bird polar exploration, hiking across the South Pole, there are people who begin to talk about fantasizing in these acts of violence against one another. When you look at people who were prisoners of war in Korea, or when you look at people who have been shipwrecked, people start to become paranoid and wish to act out against the people with which they come in contact. So the circumstances actually foster a kind of aggression and violent fantasy. Also, extraordinary risk of self-injury, and we see a lot of self-injurious behavior, people hurting themselves on purpose in solitary confinement. And with the cyclical language the cyclical logic that I often found in these circumstances, violence and self-injury were often used as explanations why the person needed to be in that place, rather than as recognizing the place as causing those kinds of behaviors. So people would say things like, of course they're monsters. They're doing these monstrous things. Of course they need to be here. They wouldn't be here if they weren't monsters. And then when you look at circumstances outside of that environment and we see, well, what is it that causes people to self-injure? We see in psychiatry that people injure themselves only in experiences of extreme desperation, only when they feel like they themselves don't know if they themselves are real any longer. They don't feel anchored to themselves. They're experiencing some extraordinary dissociation or trauma. Or in one circumstance that I learned about, when people were trying to flee Cuba to come to establish a dry foot during the wet foot, dry foot policy between Cuba and America, the Coast Guard began describing these Cuban migrants as drinking gasoline, lighting themselves on fire, hurting themselves in these various ways, swallowing dangerous objects, just to be taken to a hospital so that they could establish residency in the US. So what we see is that these are ways that people behave in desperation, and when we have taken away every other means of expression or communication or agency. This is not some external manifestation of internal horribleness. This is not a marker of how evil this person is. This is a marker of what we are doing to people when we put them in these kinds of settings.
I'm just going to interrupt for a second, just to tell our audience that we'll be taking questions from the audience in about 10 minutes or so. So there's a Q&A function, and if you could write your question or remark on the Q&A, and then we'll get to them at that time. Sorry to interrupt.
Troy, did you want to jump in?
I think, in that respect, there was a question, asking you to comment on, the corrections office and the training. I think what I'm starting to see was great about you. You answer so thoroughly that it encompasses, other questions. But I wanted to point out, that's even for the police officers, in the street. I don't think it's not about training. It's a mindset. When you're doing your job with the intention to be more punitive than the punishment that you're already receiving, because I had a couple of situations where actually I wound up having 3 police assaults, and 2 of them I was handcuffed, and they were incidents where, like, regardless of the situation, now I'm respectful, and I'm not gonna let you talk to me in the kind of way, or treat me in the kind of way, but these were things that was brought on by them, and then once what happened, they turned it over. And it's funny because I was I just graduated from the Georgetown Pivot Program last year, and one of the officers from CCA, he is now in corporate, and he came down to meet with the class. And
Joy, just tell them what CCA is.
It's been so long because it's not CCA no more. It's Civic Corp.
Okay.
It's they changed that name a long time ago.
Okay, Civic Courts.
Yeah, but it's a private prison. We was in Ohio.
I think is it the Correctional Corporation of America?
Of America, that's what it is. Yeah. Correctional Corporation of America, yeah. Right? But now it's Civic Corp.
Yeah.
But to try to shorten the story up, it's funny that, the guy came up there and, once we got to talking, and they was allowing us to dress him. He realized who I was. And we talked about the incident. He was like, "I'm sorry about what happened to you." And at that point, I hadn't, had been exonerated yet. But, he told me an interesting story. They had officers from Texas, Tennessee, and Florida. And for some reason or another, Florida officers or Florida guys don't really care too much for DC guys. But what was very interesting about the story was the lieutenant. No, he was a captain. No, he was a major. No, he was the assistant warden. I'm sorry. He was the assistant warden that I wound up getting assault on. He wound up getting killed later in a drug deal. You know what I mean? So, and I bring up that story because I'm saying that's the thing, like in all walks of life, like I said, they trying to say, about the training in the street and the training in there. They getting the training. It's just what their mindset and what their objective is in going to do the job. And that's not consistent with them being, humane or civil, to prisoners all, because a lot of people, the mindset is you there, you must have done something and you deserve to be punished to, even longer than, you were sentenced to.
So true. And I think that what you just said, Mr. Berner, that piece of like, you must have done something wrong. So, I mean, essentially you deserve whatever you get, right, when you're there. And I think that again, from a society standpoint, that was one of the things that I had the most trouble with when I would talk to people about this project, this idea that like, well, if you can't stand the time, don't do the crime. And not acknowledging that as you're one person that's evidence of this, but there's so much evidence of this. Many people in our system are innocent. Many people are there not because of criminal intent, but because of mental illness symptomatology. Many people in our jails who are there pre-trial are there because of poverty. They can't make bail, whereas people with more money would be able to be waiting their trial out, or the outcome of their trial, their plea bargain, out of the jail system. So we assume that everyone in these environments has done something wrong and so deserves whatever they get when they're in there. And without acknowledging that people are there, first of all, for all different reasons, as we've shown, racial bias, poverty, mental illness, innocence sometimes because our system is imperfect. And then also this idea that everybody deserves to be mistreated once they're in there is such a grievous human stance. So I really appreciate you bringing that up.
Along those lines, as somebody who lives and works in Virginia, over the last 6 years, I've seen some improvements in the prison system here in Virginia. But one thing that we often hear from the Department of Corrections when we push for more humane conditions and more accountability is that Virginia has a very low recidivism rate. And, there's room to quibble about that and the recency of the figures and so forth and how the figures are obtained. But how would you respond to somebody who essentially argues that their system doesn't need to be more humane because they have a low recidivism rate?
Mm-hmm.
Well, I'm famous for taking parables in my mind and then remembering them wrongly. But here's the gist of what I'm about to say. I remember reading a Buddhist story once about someone who went out on their porch every day and shook spice into the yard, and someone said, "What are you doing?" And they said, "Well, that's to keep the tigers away." And they said, "Well, how do you know that works?" And they said, "Well, because there've never been any tigers." You don't know that great that there's a low recidivism rate in Virginia. I don't think you can draw a line between harsh practices and a low recidivism rate because that's been shown in so many other places not to be a correlation. So I don't know I can see why people might be saying, hey, let's not change anything if it's working. But then I think you have to ask the question, like, well, what do you mean by working? So yes, our recidivism rate is low, but if you're harming people in the process, if you're mistreating people in the process, is that really the practice that you want as a state to continue to do? There's excellent data on low recidivism rates and humane practices. There's a whole chunk of my book that I write about the Scandinavian prison systems in Sweden and Norway. And this goes back to what Mr. Berner was saying as well, but one of the major shifts that they have made there is to treat the role of the correctional officer as partially about security, but partially as more like a social worker, so that the period of incarceration, instead of the American concept of just doing time, like you're just going to try, get through the days and have the time be the punishment, that they see that period of time as a constructive period for rebuilding, for shoring up any deficiencies that a person might have in their life, so that then when they leave the prison, the things that caused them to become involved in criminal activity have been improved during the period of time when they were in prison, so they don't seek out that criminal activity anymore. So to that end, the correctional officers receive training to be able to engage with the men and women who are incarcerated to say, hey, what happened that you got involved in that? What's going to keep you from doing that again? What are your plans for the future? What do you want going forward? How can we help while you are in here, help you achieve the goals that you need to, so that you don't end up back here? And what they find is that in Norway, the rate of recidivism was between 60 and 70% before they started these practices. And now only 20% of Norwegian prisoners are rearrested after they leave. And not only that, but to Mr. Berner's point, the morale of the correctional officers has increased substantially, because I think truly, I understand that there are very sadistic practices that some correctional officers employ. However, there is also an extremely high rate of burnout and dissatisfaction among correctional officers. They have a PTSD rate that's higher than police officers in the military. They have an extremely high suicide rate, and they're going in every day into a relationship that we make adversarial. So they're on one side, the detainees are on another side, and they are in an adversarial relationship, high stress all the time. What Norway and Sweden found was once that dynamic was shifted, and the ways that they did this were really ingenious. Correctional officers and detainees sat down to eat their meals together at the same tables. They would during rec time, they would all play intermixed on teams together. During work and school, they would be seated together in these environments. And it's much harder to hate someone when you're playing on a team with them, when you're sitting next to them, down to them at dinner. It's much harder to see them as an object of your hate when you're having human conversations with them. So what they found was that violence diminished dramatically, recidivism diminished dramatically. So I think part of these questions is an outcomes-based question, which is the right question. We don't want people to come back to prison. But part of it is also a philosophical question. What do we want these environments to be like for the people that live and work within them, and what are our beliefs around that?
I'm going to step in now and share some of the questions. We have a few questions from our audience, so I'd like to turn to that. I also have a question for Troy, actually, from someone in the audience. So, would you please ask Dr. Montross about the civil commitment facilities in 20 United States used to indefinitely detain persons who have completed sentences for sex-related crimes after their release date? These facilities are supposed to be mental hospitals, quote unquote, but are effectively prisons, and advocates have long warned that they are far more punitive than the regular prison facilities.
Mm-hmm. So this taps into a larger question, I think, which is really the question of how we look at risk in our communities. And this comes into play in sentencing. It comes into play in civil commitment facilities, and whether that's for sex offenses, or the same is true for people with mental illness who are deemed not guilty by reason of insanity, who might be committed in forensic facilities for an indefinite period of time. Some people have the belief that if someone is found not guilty by reason of insanity, they go free. That's not the case. They're remanded to a forensic psychiatric facility, and sometimes may stay years longer than they would have had they been found guilty of their crime. So I think this really boils down to how we look at risk in America and the importance of doing risk assessment. And as a psychiatrist, I feel like I can speak to this really well because I have to do it all the time. So people come into my care because they've been dangerous. They've tried to kill themselves, they've tried to hurt other people, or there's a threat that that's going to happen imminently. And so my job is that I have to treat them as best I can, identify what kinds of things have been going on, whether it's symptoms or situational, that have led to this position where they've been a risk. And then at some point, I have to feel comfortable with them leaving the hospital and going back into the community. If I wanted the risk to be zero, I would never discharge anyone from my hospital. But I can't do that. And so in medicine, we understand that you can't do that. And it's not just true in psychiatry. I write in my book about screening mammography, that if we had women begin mammograms at age 18, we would catch a few instances of fatal cancer. Some women in their 20s get fatal breast cancer and die. We would catch those women if we had everyone start mammograms at 18. But the cost of that would be insurmountable. The amount of stress and anxiety it would cause by finding benign findings in a bunch of women who then had to go down a route of medical treatment would be significant. So we've looked at the evidence, we've really analyzed the risk, and it makes sense for women to start getting mammograms at age 40. And yes, we're going to miss a few, but really on balance, this is the sensible approach. And I think we need a sensible approach like this when we look at corrections, because right now we veer far more to the side of trying to get to zero risk. So we say we'd rather incarcerate more people for more time and try to prevent any kind of bad outcome in our communities than risk letting someone go free who might do something wrong. The problem with that is it means we lock people up for these extraordinary amounts of time. I mean, there were so many instances of people that I saw with 3 consecutive life sentences or 378 years in prison. And when we are locking people up for this extraordinary amount of time without doing a methodical risk assessment to see, all right, you did this, as Mr. Berner said, maybe somebody committed a violent crime when they were 17 years old. Their brain was not fully developed when they were 20 years old. At 45, do they pose the same risk? No, we know they don't. We know neurodevelopmentally they don't. At 65, do they pose the same risk? At 70? Of course not, right? So, and yet we don't have built-in risk assessment in our system to try to ascertain if someone poses the same risk and necessitates the same level of control at 45 that they did at 25. And so I think that that's a really critical part of whether we're talking about these about sex offenses, whether we're talking about psychiatric symptomatology, and some people remain acutely dangerous. That's not to say that everyone's dangerousness evaporates over time. That's not the case. And in some sex offenses are some sexually predatory behaviors are very difficult to treat. Some people pose a consistent risk, but lumped in that category of sex offenses can also sometimes be, statutory rape charges that happen when one person's 18 and another person's 16. And those charges persist. So I think in all realms, an approach that really examines risk and is built in to assess risk serves us all very well.
Thank you for that. Here's another question. It says, without the social welfare supports in this country that the Nordic countries have, do you really think we could adopt the Norwegian penal system, which is, last part of your book goes into some length about that?
Yeah, so I didn't think so at first until I really started digging into the numbers and the realities of the system. So what I underestimated when I had the same skepticism was how extraordinarily expensive our current system is. And that's compounded for many reasons. First of all, high security has a very high expense associated with it. So sometimes we are paying, $60,000, $75,000 a year per inmate to detain them in these facilities. High security can be more than $200,000 a year to detain one person. So we are paying extraordinary sums of money toward incarcerating people in our country. And then because our recidivism rates are high and we have very long sentences, when you start multiplying those numbers out over years or over repeat offenses, our system becomes very, very expensive very, very quickly. So I think that it's sort of a false binary to say, look, they're spending all this money on these social things, we don't have that money to spend, because I think that you could argue that our budget could be reallocated in a way that would fit very much within the parameters of our budgets. I also heard a lot of people question, well, the demographics are really different, the taxation rates are really different in Scandinavia, and that's overblown too. I think the more that I looked into it, the population of Oslo in Norway is actually quite similar to Nashville, Tennessee. 60% white in Nashville, 70% native ethnically white Norwegian in Oslo, and the other 30% of Oslo citizens are either immigrants or born to immigrants. They're from Pakistan and Somalia and across Asia and Africa. And 40% of kids in Oslo speak a language that's not Norwegian as their first language. So I think we have these ideas about Scandinavia as this place that's very different than our than our home here in America. I think that's not true. And if anything, our states run prisons so differently from state to state that there's absolutely no reason that within the laboratory of our states couldn't individually decide to make these kinds of transformations and to allocate their budgets differently and to change the philosophies in the state. So I'm much more optimistic about this. Once that I really saw that, the taxation rate in America is 37%, in Norway it's 38.5%. It's not the difference that we imagined that I imagined that it was. And so I think we unnecessarily throw up obstacles to the possibility of change if we think, oh, we couldn't possibly do that.
And one last question. So this is for Troy. What is Georgetown Pivot Program?
Georgetown Pivot Program is a program for returning citizens, non-accredited. It's a business management entrepreneurship. It's 10 months. It was very beneficial, of course, for me. It put me back, in a school setting, and it kind of helped re-taught me how to learn from being away. I mean, once when I was gone, all I did was read, but being in front of actual college professors, I think for the most part, it was kind of tough because it was condensed. It's 10 months, and we done things as far as marketing, accounting, design. We had a faith-based class, but it's all condensed, with the intention of assisting you in starting your own business, or at least giving you experience through the internships to find a career. So and you get a business management entrepreneurship certificate.
Okay, thanks. So we have just about a little more than 5 minutes left. So I ask our interviewers if you have one or at the most two more questions to ask. One of our listeners wrote, just so I'm by your compassion as well as your insights. So, Gay or Troy, one more question? So,
I just wanted to say that one of the things about your book, Dr. Montross, that resonated so strongly with me was the depth of your empathy for incarcerated people. And I think many of us on the outside tend to assume that we would never be foolish enough to make the kinds of mistakes that land people in jail. But you point out that, you know, we've all done things that are illegal, but through luck and privilege, we haven't been caught. And, you know, I guess that's part of the challenge for us as advocates, is to get a critical mass of the public to see incarcerated people the way you do, and to care about them, how they're treated in the prison system, so that we can hold the system more accountable for the way it treats people.
Yeah, I mean, I think it's easier, right? It's easier for those of us who live free lives to think that there's something morally superior about us that keeps us out of the cages. You and I are, who live our lives outside of prison. And you speak about a section of the book that was really helpful in framing this question for me, because we have a phrase where I grew up in Indiana. We were talking about Midwesterners on the panel here today, saying, you know, he was born on third base and thinks he hit a triple. And I think that misallocation of, like, we are where we are because of who we are, and those people are over there or where they are because of who they are, is so dangerous. Because as I write about in the book, one night at a dinner party with my friends, we went around the table and started listing all of the ways in which we'd broken the law. And the list was long, and it wasn't just shoplifting things when we were kids and going on a scavenger hunt in college where everything had to be stolen, but it was also things like carrying a firearm without a license across a college campus, and forging a trade license, and smuggling something through customs. And a friend of mine was describing mailing marijuana edibles from her state to a friend in another state. Marijuana was illegal in her state at the time. It's illegal in the state where she was mailing them. And I said to her, you know that's interstate drug trafficking. That's a federal crime. And she said, well, I guess it wasn't very smart of me to use my credit card to pay for the postage then. And so the ways in which those of us who've not come in contact with the legal system do not expect to, despite the fact that we engage in behavior that lands other people very much behind bars and for long periods of time, I think is one critical myth that we have to crack open if we want to deal compassionately with our incarcerated fellow citizens. Because our ability to extricate ourselves from our crimes is much more often at play than our ability to commit crimes. And I think that being honest with ourselves, that many of us drive in unsafe ways, text and email and drive every day, and cheat on our income taxes, and, you know, various things that are criminal behaviors, but we don't expect to have any kind of consequence from those, is very much a function of our privilege and our often financial standing, racial standing, as opposed to anything deeply moral about ourselves. So I think that's a really important point. I'm glad it's one that you raised.
One last question.
Well, I think obviously, you know, we all know that we're in a time, you know, civil unrest and, you know, and division. I think, you know, when you're speaking about Norway, Nordic and Scandinavia and America and the differences in how their systems ran and what's going on, I think it's important that it's not forgotten that it's different, because their intentions, you know, and their designs are different, you know, in the same way that they spending money. you know, in housing a prisoner, they making money from the system in itself. You know what I'm saying? So that's gonna be the difference until we come to a place where we understand, like, you know, the root of it, where the root of the prison system come from, and obviously is rooted in racism. You know what I'm saying? So if one thing about life, you have to, at every stage and whatever level it is, you're gonna have to be able to have hard conversations and make hard decisions. And until this country, I think, you know, sit down and people are honest, you know, you're a doctor, you've been directly in the situation. So in a sense, you're directly impacted yourself. So you got to understand it. And you got compassion in your heart to see things for what they are. But you have others that just, like, you know, it doesn't involve me. They don't feel no type of relation to, you know, our demographic of people. So, you know, there's no issue. So do you think, you know, going forward, have you ever recognized the need, you know, for some type of coalition between law professionals, doctors, or health professionals, psychiatric professionals, and directly impacted people going forward to, like, if we're really going to find a way to make things better and even a playing field out, do you see that being a possibility, and how do you see going about doing it?
This is a great question to end on, because I think it's really one with a lot of hope at its core. So at a time when there's almost zero bipartisanship in our country, prison reform is an issue with bipartisan support. So there was a panel a couple of years ago where Newt Gingrich and Cory Booker were on stage together, both of them advocating for prison reform. So I think there are, and you hear voices on the right and the left really taking issue with the fact that our prisons need close scrutiny and examination. We need our practices to be different. So I think there's a great deal of hope in that regard. And I think also one of the things that you mentioned that's critically important is bringing the stakeholders together. You know, you say doctors, lawyers, but I also think bringing together and recognizing that the goals of police and corrections may not actually be fundamentally different from the goals of the people. You know, one of the models that I think points this out so beautifully, you know, I get asked a lot right now, your question about training and mental health training, I get asked a lot right now, do you think police need more mental health training? And I often say to people, I think that's the wrong question. The right question is, why are the first line responders to a psychiatric emergency police, when the first line responders to every other healthcare emergency are trained clinicians? You know, we send EMTs and we send paramedics who can start IV fluids, administer oxygen, stabilize a fracture, stop bleeding. We send trained people who can intervene to health emergencies. And yet we don't send trained clinicians to mental health emergencies. And why is that? And I think there are models of places. There's a wonderful organization in Oregon that has begun working with police so that when police receive psychiatric emergency phone calls, it is this organization, this mental health organization, that responds. They have the option to call police for backup, which it turns out they rarely do. They go in unarmed, they de-escalate the situation, and they've never had a fatality, they've never had a serious injury. And out of the tens of thousands of times that they've gone to these emergencies, I think the last year they had 20,000 calls. I'm going to get the numbers a little wrong, but it's on this scale, 20,000 calls, and they called police for backup like 150 times. So I think part of the question going forward is, and the police are delighted by this, because it means that they don't have to respond to these fraught, high intensity situations, and then they have more time to tend to real police emergencies. So I think those kinds of models where we see that these questions are not all questions of opposition. It's not all one side over here and the other side over there and no middle ground, but often it's a general dissatisfaction, a general acknowledgement, you know, correctional officers are miserable and the detainees are miserable. Well, that doesn't seem like a very good situation. Republicans aren't happy, Democrats aren't happy. That's not a great situation. So I think there are these moments where we can say, okay, then how do we move forward together and find a solution that is more humane, more economically savvy in some situations, and serves all the stakeholders in the group. So I think your suggestion of coalitions is a really beautiful way of phrasing a way to move forward where all the stakeholders join together to say it's time for change in our system.
Thank you so much, Dr. Montross, for giving us your time. A wonderful discussion today. I want to thank Gay Gardner and Troy Berner for being interviewers and asking great questions, and the audience, some of the questions from the audience as well. So we've recorded this conversation, which we'll be posting on our website and also most likely on social media. So I hope you urge your friends to listen to it, because I think a lot to learn here. Dr. Montross has a lot to teach all of us. So. In many, many ways. So thank you all again. Dr.
Montross.
Yeah, there's the book, Waiting for an Echo. Yeah, thank you, Troy, for reminding me. Waiting for an Echo, The Madness of American Incarceration by Dr. Christine Montross, published by Penguin Press. So a very accessible book to read and a lot to learn. So, thank you so much, Dr. Montross. I wish you a good day. And thank you, Gay and Troy, for joining me.
Thank you
so much. I really enjoyed it.
Thank you, Dr. Montross.
Very nice to meet you all.
Thank you, Gay.